Hello, and welcome to Using a Nebulizer. This learning module is brought to you by Cornerstone Pediatrics. The information on this site is available to you solely for general information purposes. Information on the site is not intended to diagnose or treat any illness. You should talk to your healthcare provider about how information on the site applies to your health conditions. We'll review the following questions. What is a nebulizer? Why do we need a nebulizer? How do I use a nebulizer? And how do I clean a nebulizer? A nebulizer is a machine that changes liquid medication into a mist, which is also called aerosol. Some aerosolized medications can treat illnesses of the lungs. Why do we need a nebulizer? A nebulizer provides medication that can relax the airways, decrease wheezing, and help clear mucus. We typically use a nebulizer in children younger than the age of 7 versus inhalers. How do I use a nebulizer? First, plug in your compressor machine. Wash your hands and gather the parts. Unscrew the lid of the medication cup, add medication, and screw the lid on. Connect long tubing to the medicine cup and compressor. If you're using the face mask, connect it to the medicine cup. If you're using the mouthpiece, connect it to one end of the T-piece. Connect the T-piece then to the medicine cup. Deliver the prescribed dose, tapping the medicine cup if you are giving the full vial of medicine. Hello, and welcome to Pediatric Nebulizer Use. I've gathered our equipment here. You'll want to plug in your compressor machine and then wash your hands before we touch our equipment. Your healthcare provider will have prescribed medication for you to breathe easier. Today we're using albuterol. I brought two different medicine cups to show you the differences. They both will hold medication. For one, the connector to the tubing goes here. The other one, the connection to the tubing is down here. Today we'll use this blue cup with the connection up top. You'll take your medicine cup and unscrew the lid. You'll remove the top from the medication vial by twisting and squeeze the medication into the medicine cup. Replace the lid to the medicine cup. There are two ways to inhale this medication. For the older child, we use this mouthpiece. For the younger child, we use a face mask. If you use the mouthpiece for the older child, you will connect it to a T-shaped piece. You connect it to one end, like this. You then connect your mouthpiece to your medication cup, like this. It works better for most people to hold the mouthpiece this way and the tubing to come out this direction. Today we'll use the face mask for the younger child. We'll put it directly onto the medicine cup with the tubing facing out. We'll set that down and start connecting our long tubing between the nebulizer machine and our medicine cup. I'll plug in the nebulizer tubing first, making sure it's pushed down really well. And the other end will go to our medicine cup. Now we're going to turn on the nebulizer machine and look for mist to come out. That mist is the medication to complete this breathing treatment. You'll want to deliver the amount prescribed And you may need to tap the medicine cup to bring the droplets back down to nebulize into mist. Thanks for learning how to use a nebulizer for the pediatric patient. Cleaning the nebulizer. Follow the instructions in your owner's manual. Wash the mask or the mouthpiece, the T-piece, and medicine cup with soapy water, rinse and air dry after each use. Do not wash the thin, long tubing. After the last treatment of the day, soak the parts listed above in a solution of 1 part vinegar to 3 parts water for 15 minutes. Rinse and let air dry. Wipe the compressor with a damp cloth each week. Thank you for learning about how to use a nebulizer. For technical questions, please call the manufacturer. For medical questions, please call your provider. If you are experiencing a medical emergency, please dial 911 immediately. Do not rely on this information as a substitute for professional medical advice. Thanks for learning with Cornerstone Medical Group.